In this video, here's what we'll cover: what autism actually is, why adults are diagnosed late, masking and camouflaging, how autism presents in women, what an assessment involves. A few months ago, a woman in her early 40s sat down in my consulting room and said something I hear more and more often. She had a good job, a family, and friends. From the outside, her life looked completely fine. But she described a lifetime of quiet exhaustion, rehearsing conversations in her head before she had them, forcing eye contact, coming home from social events so drained she could barely speak. She had been treated for anxiety and for depression more than once, yet nothing had ever explained the whole picture. When we finished her assessment, she met the criteria for autism. Her reaction was not distress, it was relief. For the first time, the pieces finally fit. Stories like hers are becoming far more common, especially among women, and today I want to walk you through what the recognition really involves. Let me start with what autism actually is. In the DSM-5 it is called Autism Spectrum Disorder, or ASD. It is a lifelong neurodevelopmental difference in how a person communicates, relates to others, processes information, and experiences the world around them. It is not an illness, and it is not something that suddenly appears in adulthood. It is present from early childhood, even when nobody notices it for years. The manual describes two core areas. One is social communication, such as differences in reading social cues or holding a back-and-forth conversation. The other is restricted and repetitive patterns, like a strong need for routine, deep and focused interests, or sensitivities to noise, light, and touch. The word spectrum really matters here. Autism looks different in every single person, and many people learn, slowly, to hide the parts that feel different. That brings me to my second point: why so many adults are only recognized late. For decades, the research and the diagnostic descriptions centered on young boys with more visible traits. Anyone who did not match that narrow picture was easily missed. Our understanding has changed enormously, but many adults grew up when autism was rarely recognized unless it was severe and obvious. On top of that, bright and capable people often develop clever ways to cope, so their struggles get read as anxiety or burnout, and treated on their own. Research shows anxiety and depression are notably more common in autistic adults, so it is easy to treat the surface and miss the source underneath. The single biggest reason autism stays hidden is masking, sometimes called camouflaging. This is the conscious and unconscious effort to compensate for, or hide, autistic traits in order to fit in. Masking can look like forcing eye contact, rehearsing what to say before a conversation, copying other people's expressions and tone, pushing through sensory discomfort without showing it, or hiding self-soothing movements. In a landmark study, researchers described people who felt they were performing a role full-time, with no real sense of who they were underneath. The consequences included exhaustion, anxiety, and a threatened sense of self. And here is the crucial part: masking can make autism almost invisible in a short appointment. That is exactly why a careful, in-depth assessment matters far more than a quick first impression. My fourth point is close to my heart, because it explains so many late diagnoses. Autistic women and girls are often recognized much later than men, despite having very similar underlying traits. Recent research comparing autistic men and women found that women tend to camouflage more, and that heavier camouflaging was linked to a later diagnosis. In other words, the very skill that helps someone cope can also delay the recognition they need. In women, autism might look like intense but socially acceptable interests, a few close friendships that are still effortful to keep, or years of being seen as shy, sensitive, or a perfectionist. Strong social motivation can sit right alongside deep social exhaustion. Because the early research centered on boys, many women's experiences simply did not match the textbook, and so the question of autism was never even asked. So what does a good assessment actually involve? In Australia, best practice follows the national guideline developed by the Autism CRC. It is never a single test. In my practice, a thorough adult assessment usually includes a detailed clinical interview about your experiences today, and a developmental history that looks back at your early childhood, ideally with information from someone who has known you a long time. We use validated tools, which may include the ADOS-2, a structured and internationally recognized measure, alongside questionnaires like the CAQ. But the ADOS-2 is only one source of evidence, not the final word, because it has known limits with adults who mask well. We also think carefully about conditions that often sit alongside autism, like ADHD, anxiety, and depression, and whether another explanation fits better. That careful weighing is what protects against both over- and underdiagnosis. For many adults, a diagnosis is not really about a label. It is about understanding. Finally has a kinder answer, and mental health care can start addressing the real picture, rather than just the symptoms sitting on top. A diagnosis at any age can bring self-compassion, and guide practical adjustments at work or in study. If you have spent years wondering whether autism explains your experience, an assessment can give you a genuine answer, and a way forward. You can read our full guide, or book an appointment, using the links in the description below. At Potentialz Unlimited in Bella Vista, we would be glad to walk that path with you, whenever you feel ready. Before you go, here's a quick recap of what we covered. What autism actually is. Why adults are diagnosed late. Masking and camouflaging. How autism presents in women. What an assessment involves. And one small thing that really helps more people find this. Subscribe for weekly mental health explainers. Like this video if you found it helpful. Share it with someone who might need it.